We are being joined by Dr. Veer Pushpa Gupta. He's an NHS doctor, researcher and member of Royal Society of Medicine live from London. Welcome to the broadcast. Now, the Unison that has just accepted a new government pay deal has condemned the spending money on private 999 care. It is calling the move a short-term fix and not a long-term solution. How are you assessing this crisis?
Yeah, as you mentioned, you very rightly said that the NHS is in crisis, but I think we need to look at it from a broader perspective. The NHS is quite a large organization. In fact, it's the largest employer in the Western world. It employs about 3 million people. The annual budget of the NHS is about £180 billion, which is more than most health services around the world. But I think it's the management of the funds that has taken a hit in the NHS in the last few years, and allocation of funds has not gone where it should go. And as you know, last week, the junior doctors had gone on strike. The upcoming strikes on the bank holiday weekend of the nurses is going to cripple the system even more. And it all comes down to the primary care and the ambulance services and the A&E services, which are hit the most because there's a backlog that goes, and then it cripples the public healthcare system that was running quite efficiently actually up till a few years ago. But obviously COVID has helped in making that worse, and the ambulance services are suffering as well. So one of the examples that you gave about 1 million a week for private ambulances, I think at the moment, if you think about the waiting times for an ambulance, the national waiting time should be about 18 minutes. In the area where I practice, it's about 53 minutes. So we have a problem on our hands and something needs to be done.
Those are some alarming numbers, by the way, but let's go back to something you just briefly mentioned. Something so fundamental as the NHS is in a state of crisis. Did the COVID-19 pandemic bring the latent issues to the fore, as you also mentioned, or was the government naive to the long-time problem?
I think it's a bit of both. What you mentioned, the latter is probably more true. The government has ignored the NHS for a long time now. Year on year, the crisis has just grown in size, and now it's just become this big monster in the room. I mean, we have junior doctors striking, we have nurses striking. The entire backlog of the COVID-19 pandemic, with elective surgeries, with clinic dates, which have all been pushed back, is now being pushed back even further. So you have waiting times of about 1 year for elective surgeries, for simple things like knee replacements or joint replacements. I mean, it is a system that needs an overhaul. It needs resuscitation. But let's not forget that it is the world's largest public healthcare system, which provides free of cost healthcare to 70 million people. There's no other nation in the world that has a healthcare system that runs in a way that provides free healthcare to 70 million people. So it's not an easy fix. It is going to be a difficult fix, but Rishi Sunak did say in his campaigning, when he was campaigning, that he is going to take NHS seriously. It doesn't look like that's happened so far. The doctors are not happy, the nurses are not happy, the paramedics are suffering, and ultimately it's the patients that are suffering.
All right. Thank you so much for all those insights, Dr. Gupta.
Thank you very much.